I want to make sure that we stay committed to clearing up any misconceptions. Obviously, the things that were taught or research that was done 10, 15, 20 years ago may not be applicable today. For example, bruising. Obviously an issue with people who were trained years and years ago, but not necessarily part of today's curriculum. Mike, speak to a little bit about how the training addresses this today versus maybe it was 18 years ago.
We definitely addressed that issue in our trainings, and back in 1999 there was a research study that came out on instrument-assisted soft tissue mobilization that showed the more pressure you use, the more fibroblasts you produce. And we know that fibroblasts produce collagen, and so we think that's a good thing. But people started thinking more was better and started getting very aggressive, very heavy-handed with the instruments, thinking that they were helping their patients more by being more aggressive with them and damaging healthy tissue and causing the successive bruising. And we definitely learned from those mistakes, and the research has definitely shown that you don't have to be that heavy-handed, you don't have to be that aggressive. That is probably one of the biggest surprises from our participants when they attend our trainings, is how less aggressive this technique is than maybe what they would have first thought. And you come at your patient with a tray of metal instruments, it's intimidating. But it's refreshing when the patient can experience the technique properly and they notice that it's not near the uncomfortable intervention where they may have thought it was, or maybe the rumors or maybe the YouTube videos, the old YouTube videos that are out there and may have indicated. But if you are doing things like a cross friction with your fingertip properly, that is not a pleasant experience. If you are treated with Graston Technique properly, in a similar fashion, it's a much more tolerable treatment, which I know is counterintuitive. You think, how would a metal instrument be more comfortable than a fleshy fingertip?
Well, this is a much broader surface.
But it is, and it's, you'd have to take out the slack of the soft tissue and whatnot, but the treatment edge is so much more precise than the pad of your finger. So it's so much more of a tolerable treatment as well as a more effective intervention.
And I think it should be noted that those original studies were done on rats. Well, this is humans that we're treating, and so when you take it from that animal model to the human model, there is that realm where you have to work within patient tolerance, which everybody does, but you also have to work with that specificity to the level of the lesion so that you're isolating any pressure to the area that's involved and not inadvertently causing microtrauma to the surrounding area. Also, again, the original treatment diagnoses were more of your degenerative processes like a tendinosis. And so we started off by recreating the microtrauma to help promote that tissue healing and repair. But there's so many conditions that don't require that. They come in at different stages of recovery or different types of pathology that you're focusing on reducing edema. You're not going to apply the pressure that would be high pressure at all. It would be light pressure in order to help move that fluid out of that area. So it's much more, the parameters are tailored that are specific to a given condition.
And I found too in our trainings we do spend much more time talking about those parameters and the dosage of the intervention, and we've learned proper dosage through experience, through research.